Hi everybody, Noah here again. It's been a couple days since I've done the last vlog post. It's been kind of hard getting the motivation. I'm kind of going through that depressive episode that I said was coming. It's been tough, especially trying to deal with my car situation. It screwed up again today, but hopefully this time it's finally fixed. Getting to work was kind of helpful. Just being able to go through the normal routine of the day, helping kids, really just kind of enjoying everybody I work with, and really my job in general was a big help to me today. I have been not feeling so great physically either. It's one of the kind of symptoms of kind of a depressive episode, is that not only mentally do you feel kind of drained, but physically you do too. So the workout routine kind of got put on hold for a few days. The first day after, I was really sore, but these last 2 or 3 days have been difficult, just to kind of get motivation to do anything, kind of to get out of bed. I've been trying to take my medicine as prescribed, trying to take it every day, because when you don't, the side effects could be kind of nasty. Like nausea is a pretty bad side effect of coming off of both of mine. It's also kind of a nasty side effect of going on them. It's kind of one of those damned if you do, damned if you don't. And that was one of the things I want to talk about today, since I'm still kind of going through kind of that depressive phase. But I wanted to talk about some of the physical symptoms of dealing with a depressive episode or a manic episode, or some of the physical side effects of medication. So to start, since I'm kind of in one of those kind of depressive fugues, the physical symptoms, physical sensations are fatigue, just a lack of energy, loss of appetite. For me, I kind of lose sleep either way. Like I start having insomnia issues regardless of which cycle I'm going through. It's kind of the opposite of like a manic episode, where you feel like you have all this energy and you can't really release it. This is more like I have weights tied to my hands and legs, and things just don't want to move. My brain's going slower. I'm kind of losing words. It's still kind of loud and buzzy. It's hard to focus. But it's like slogging through mud. It's horrible. Not that I always feel weird about doing these, because it's not like I want a whole lot of sympathy or I want to be pity. It's just, it's an uncomfortable sensation physically. So when you know somebody who is depressed, it's very difficult for them to do anything, move any of that. Today I had to deal with the mechanic and the tow truck driver and go to work. I really didn't have a whole lot of energy to do anything else. I got a little bit of homework done, but it was just one of those days. I really don't have much energy or mental faculty to deal with much. My immediate family, Sammy and Jackie and I, kind of refer to it as having spoons. Like I just did not have the spoons today. Some of the side effects of a manic episode are going to be that buzzy, uncomfortable energy that you can't really feel like you can release. My mixed states kind of combine the buzziness with the slogging through mud, so it's like I feel like I should be running through mud, but I can barely walk. And that's very irritating. But those are usually only my manic episodes. My depressive episodes are very, I would say, typical for a depressive state. Thankfully, I'm pretty good at kind of faking it till I make it, especially when I'm at work. But I'm definitely feeling a little bit slower, a little bit more out of it today. One of the other side effects, physical side effects I can have from a manic episode is insomnia. Like I said, I have insomnia from both episodes. Some people experience hypersexuality, where they're constantly aroused or very frequently aroused. And a lot of people with bipolar disorder end up having fidelity issues, especially during manic episodes. I thankfully have not had that issue, at least not when it comes to fidelity. I will say during manic episodes I tend to be more aroused, and depressive episodes I'm less aroused. But I thankfully haven't had too many fidelity issues. It's not so overwhelming for me. But I know for some people it's a big issue. The general malaise that kind of comes with depression's uncomfortable. It reminds me a lot of like flu symptoms. It's just everything hurts and nothing feels good, and everything just feels slow and uncomfortable. And then manic episodes, everything feels sped up. It's almost like you drink a bunch of caffeine, you're kind of jittery. Can be shaky sometimes. I've had times where like my hands would tremor really bad from it. My medication can have some side effects too that are kind of uncomfortable. Nausea, like I said, is a big one, especially starting new meds, weaning off old meds, increasing doses. Nausea is the most common and worst side effect for me. I'll have headaches. That's a pretty common side effect from switching medication. The long-term side effects of kind of long-term benzodiazepine use as an as-needed, along with long-term use of Topamax, which is my mood stabilizer, has kind of impeded my memory. My short-term memory was especially badly affected, but my long-term memory isn't as good as it used to be. It's definitely been affected too. Topamax can make me have some really bad neuropathy. I mean, it's an anti-seizure med, but yeah, I'll have neuropathy in my hands, especially, or side of my head, or just anywhere. I'll have some of these shooting nerve pains sometimes. Tremors are occasional, especially when I'm stressed. I'll get real bad tremors. This might be like too much information, but when I first started Cymbalta and Topamax, I don't know which one of them did it, but I was having a horrible problem with frequent urination, like every 15 minutes for about 48 hours. It was so uncomfortable. That was not a fun side effect. Cymbalta is known to raise blood pressure, so that's a pretty common side effect. I was on a blood pressure medication for a while. But I lost my insurance, can't really afford all of it. So, I get pretty nasty nightmares. I mean, I used to before I started my medication, but especially after starting Cymbalta and Topamax, I would get pretty nasty nightmares. When I first started the Cymbalta, I would have feelings of like hot water being poured down my back, like so hot that it feels cold at first and then it starts to burn. And that would happen on more than just my back, just on my skin in general. That went away after a while. Most of my side effects have gone away after, medicinal dose has built up in your system. My memory hasn't. I'm pretty much conceded the fact my memory is never going to be the same after this. The neuropathy seems to be pretty permanent. Even when I've gone off my medication, I seem to still have it. I have to be careful of my liver because both of them are hepatically metabolized, so I can't put too much stress on that. Topamax, if I don't stay adequately hydrated, can give me kidney stones, and I have had some pretty nasty ones from Topamax, especially when I first started, because I have a bad habit of not drinking enough water and drinking way too much caffeine. So those two did not go together well. So if you're starting kind of your journey through medication and treatment, know that there are going to be some side effects, and to watch out for them, and to speak to your doctor, your psychiatrist, or your general doctor about them. If you know somebody who is kind of bipolar or is just starting to go through it, be kind. The medication's not great on our body. Yeah, it helps with our mood, but sometimes it's still hard to be happy when, you've got nerve pain and a crappy memory. Especially when they're first starting. Like, it's very uncomfortable to start these medications the first time around. They're toxic. They're toxic in high doses, like any other medication, and your body recognizes that, and it fights against it at first. So, be kind when they're starting through it, especially if they're taking something like a Wellbutrin or a Topamax or Seroquel, because their memory will be out and they will be pretty zonked for a while. Just keep an eye on your loved ones. All antidepressants pretty much carry a black box warning that they can increase suicidality and other psychological issues. Anytime you're messing with medication that messes with your brain, there are some suicidality risks. So when somebody's kind of going through the beginning of their medication journey, or if you are going through the beginning of your medication journey and you start experiencing more frequent or more intense thoughts of suicide, please talk to your doctor, because those are very important side effects, and you should get on something different if it's affecting you like that. Either change the dosage or change the medication, because if it's giving you suicidal ideations, it's time for a change. Sometimes it's just about getting the cocktail right and balancing it, and other times it needs to be completely changed altogether. But do your best and be careful. Sometimes your doctor might put you on what's called off-label. My Topamax is an off-label mood stabilizer, because the normal ones, like a Lamictal or an Abilify, stuff like that, just didn't work for me. So be aware, if something's not working, there are other options, as well as electroconvulsive therapy for people who medication just does not help at all. And there's also some cognitive behavioral therapy that'll help you learn how to cope while you're on medication. Remember that medication is like getting crutches when you have a broken leg. It helps you walk, but you still have to do the work. So if you're feeling discouraged that nothing's magically cured after starting medication treatment, know that it's a journey, and you're going to have to go down it. You're going to have to learn some coping mechanisms to go forward. The medication can't do it all on its own. You got to put in some of the work too, and that's one of those things that I've had to learn kind of the hard way. So this is going to be the end of this video. I don't know if I'm going to do another one tomorrow. It depends kind of how I feel after work. I'm going to be pretty exhausted, and this upcoming weekend I have a Halloween party. So we'll kind of see how my upload schedule is going to be. Thanks again for supporting the channel, you guys. I'm seeing several views on some of the videos. I hope you're all doing well, and if there's any specific questions you guys have, leave it in the comments. Let me know if there's anything I can answer for you. I'd love to do it, and if I can't, I'll try and point you to somebody who can. Thanks. See you next time.